I am going to be reporting on Williams syndrome. It is a syndrome that has distinguished facial features such as puffiness around the eyes, a short nose with a broad nose tip, a wide mouth, full cheeks, full lips, and a small chin. Some other physical characteristics are a long neck, swooping shoulders, a short stature, limited mobility in joints, a curvature of the spine, and also there's a star-like pattern in the iris of the eye. You can have some of these characteristics and not all. Some of the developmental characteristics are learning disabilities, and there can be mild to moderate mental retardation. The range of cognitive abilities varies significantly. Often, children with Williams syndrome are over-friendly and have some form of anxiety. Infants are very colicky-like for up to 10 months due to the high levels of calcium in their bodies, causing discomfort in their stomach. The colic seems to go away very abruptly, and the baby is then very happy. Feeding is difficult due to the stomach discomfort. This keeps the babies from gaining weight, and there's often a low birth weight. Children with Williams syndrome seem to walk later in life than a typically developing child due to the lack of strength and balance and coordination. Fine motor skills also seem to develop later for the same reasons. They also seem to have very sensitive hearing. Williams syndrome is said to be quite rare, occurring in 1 out of every 7,500 births. There is a clinical diagnosis based on a combination of distinguishing characteristics such as the facial appearance, the elevated blood calcium level, a low birth weight and low weight gain, feeding problems, colic, dental abnormalities such as small teeth and widely spaced teeth, sensitive hearing, musculoskeletal problems such as low muscle tone and stiff joints, developmental delays, and over-friendliness. There is a medical genetic test called FISH. It's a specialized chromosome analysis utilizing specially prepared elastine probes. If 2 copies of the elastine gene, one of each chromosome 7 copy, the child probably does not have Williams syndrome, but if only 1 copy is found, then the diagnosis of Williams syndrome is given. Williams syndrome is a neurobehavioral congenital disorder that occurs randomly. It is not due to any medical conditions, it does not run in the family, and it is not caused by the environment. However, individuals with Williams syndrome are more likely to have a child with Williams syndrome. Williams syndrome affects chromosome number 7. Significant early intervention does seem to help children with Williams syndrome later on in life. Feeding is an issue during the first few months of life due to the discomfort because of high calcium levels. This can be helped by a low vitamin D diet, and this may also help the colicky-like symptoms that seem to be associated with the stomach pain. It has been found that early intervention in the cognitive and physical areas have helped children with Williams syndrome show improvement in their later years. Areas of self-help also are a target. For example, toileting seems to be an issue during the toddler years because they have high anxiety levels. Dressing and undressing due to the lack of fine motor skills and coordination also becomes an issue as they get older. It has been found that breaking down these skills into smaller steps helps children with Williams syndrome learn the skill and also facilitates independence. Writing has been problematic for children with Williams syndrome as they get older, also because of the fine motor skills that they seem to have a little bit of trouble with. Working on fine motor skills as a preschooler or younger will help move this skill along. Having coloring time, drawing with sidewalk chalk, or playing with small toys when young will help build fine motor skills. Also, music therapy and learning through music has been found to be beneficial. Some great resources for teachers are, of course, the parents of the child. You can get lots of information from the people who know the child best, past teachers and therapists. You can find out what works for the child and what hasn't worked. And then there's a couple of additional websites that are extremely helpful. One of them is www.wsf.org. and this explains Williams syndrome very well and also has helpful information for teachers about behaviors that a child with Williams syndrome can be exhibiting, intervention strategies, and also what to expect as they get older. And another website is www.williams-syndrome.org, and this explains Williams syndrome very well also, and it has different sections for teachers, doctors, and parents, and this can serve as a really good resource for teachers to involve the parents in your classroom of children with Williams syndrome.